Hi everyone, my name is Alice Perkins. I am doing my presentation on the preparatory test anxiety, cognitive, emotionality, and behavior components. The authors are Aran Shedak, Itamar Levy-Frank, Sigal Levy, Tamar Amitai, and Efrat Shedak. All right, preparatory test anxiety. What is test anxiety? Test anxiety interferes with one's abilities to communicate what one knows. The major components of test anxiety are worry and emotionality or tenseness. Test anxiety may include excessive learning, perceptions of low control, and unstable self-esteem. Cognitive and behavioral symptoms can include avoiding situations that involve testing. This can involve skipping class or even dropping out of school. In other cases, people might use drugs or alcohol to cope with the symptoms of anxiety. Emotional symptoms of test anxiety can include depression, low self-esteem, anger, and feeling helplessness. There are steps that students can take to alleviate these unpleasant and oftentimes harmful symptoms. But learning more about the possible causes of their test anxiety, students can begin to look for helpful solutions. So this study did a preparatory test anxiety questionnaire, and the study seeks to explore the relations between early preparatory test anxiety and excessive learning. The questionnaire was given to 365 first and second year college students in the undergraduate psychology program. There was 302 female and 63 males. 4 clinical psychologists familiar with test anxiety graded the PTAQ. And the participants in the study were to rate each statement on how they described their feelings, thoughts, and behaviors in the days and weeks leading up to the test. The questionnaire had 2 subscales of 8 items each. The subscales included cognitive and emotionality. 4 additional questions checked for more general thoughts and feelings outside the test situations. They rated the questions from 1 very low to 5 very high, depending on how they were feeling. And the scores of the test ranged from 20, which was very low anxiety, to 80, which was very high. And the results from this questionnaire was that the emotions are the biggest factor in test anxiety. Anxious emotions and cognitions are present days and even weeks before tests. And there is a significant correlation between the behavior subscale and the emotional subscale. There is a relationship between preparatory test anxiety and excessive learning. The presence of excessive learning at an early stage, avoidance, academic procrastination, correlates with test anxiety. I've determined I have test anxiety. And so, how to overcome test anxiety. Students with preparatory test anxiety and excessive learning could benefit from adequate interventions that would help them improve their learning strategies, such as breathing exercises, focusing on what they're studying, trying to relax, dress comfortably, study a lot before, envision the post-test relief, self-talk, watch what you eat and drink, and laugh.